Hello, my name is Dr. Zara Patel, and I am the Director of Endoscopic Skull-Base Surgery here in the Department of Otolaryngology, Head and Neck Surgery, or otherwise known as ENT, here at Stanford University. And if you're watching this video, you're likely scheduled to have an endoscopic skull-base surgery with myself and one of our neurosurgeons. So I want to help you in this video understand how we're going to go about doing that surgery, what to expect during, directly after, and long-term after the surgery. And so part of what I tell you in this video will likely be repeat information from what you've already heard from the neurosurgical team in their office, but I just want to make sure you have a really good understanding going into this type of surgery. So first, I'm going to just share my screen and talk to you a little bit about what I mean about skull-base surgery. So you can see this image here in the middle. This is if you were looking down the middle of your head from the side. And this thin plate of bone that separates the sinus and nasal cavity from the intracranial cavity where the brain sits above, that is what we call the skull base. And you can see that in this little area, right in the middle of the head, is where your pituitary gland sits. Many of the tumors that we perform endoscopic skull-base surgery for are tumors associated with the pituitary gland. But some of you may have tumors that are in this same region of the skull base but are not associated with the pituitary gland. Either way, you can see that right above the skull base is all this really important stuff that we don't want to have to go through to access this area. And so the great thing is that we can actually go through the nasal cavity, and you can see it's just a nice straight shot back to the skull base through mostly air-filled spaces. So that's the benefit of this type of surgery. And basically, I'm the person that starts the surgery. I go into the nasal cavity and I gently move aside and protect all these normal nasal structures. And then I open up this last back sinus called the sphenoid sinus and give the neurosurgeon really good access from both sides of your nose to access the tumor that they can then come in and join me to remove. Once they come in and join me, I stay in the surgery and I'm kind of the eyes of the procedure. So with that endoscope, that camera that I'm using, I can show the entire tumor, make sure that the neurosurgeon can see all aspects of the tumor that they want to remove, and then also all the really important critical structures that surround that tumor and maybe interacting with the tumor. So the neurosurgical office has likely, hopefully already discussed with you all of the possible risks of this type of surgery. And the main big risks really have to do with the brain, all of those really important cranial nerves that allow you to see, allow your eyes to move around, allow you to have sensation on your face, all of those types of things. And then also the big vessels that bring all the blood to your brain and back out, and the eyes that are on either side of the area that we're working. So those are the major things to think about as far as risks of this surgery. But from a nasal perspective, what I would just talk about are two things. One is your sense of smell. Your olfactory nerves that allow you to smell are all the way at the very high and deep part of the nasal cavity. And they are right above where we tend to work as we're accessing the skull base. I take great care to preserve all of those olfactory nerves, the entire patch of the mucosal surface that contains those nerves. We take great care to preserve for you. In spite of that, just because of all the inflammation during surgery and after surgery in your nose, some people still have some issues with smell and taste after this type of surgery. I've done a lot of research in this area, and so there are certain things that we can do and try to help people bring back their normal sense of smell and taste. For the vast majority of people, there's just a sort of 2-week temporary decrease, and then it will spontaneously come back as you start to heal more and more. But for that very small percentage of patients that has any sort of persistent issues, there are definitely things we can try. And so you'll just let me know about how you're doing with that after this type of procedure. The other thing to consider is just how you're doing in your sinus and nasal cavity overall. If people have allergies or chronic sinus issues going into this type of surgery, sometimes that can prolong the healing period and flare that type of inflammatory response. But I'll just work with you as we go through the healing period to make sure that that's completely taken care of and that we're doing what we need to do to make sure that that resolves well. The last thing to think about is sometimes when you're going through the nasal cavity to access the back of the nose, we have to remove some of the tissue in order to get that wide open space that we need. Some people have cartilage that makes up the surface of the nose that is a little bit weaker than other people. It would be very, very rare for anything to change about the outside appearance of your nasal cavity or your nose after this procedure, but very rarely that can happen if you have an inherent weakness of that cartilage. And so that's, again, something that we will simply watch for in your postoperative healing period. And if anything does change, then certainly we could direct you or send you over to our facial plastics colleagues who can do procedures to change it back to how it was before. Now, having said all that, overall, this is a very low risk, minimally invasive type of procedure, and most people heal really, really well with no problems or complications afterwards. So let's talk a little bit about, once we're in there for surgery, like I said, I kind of do the approach and get the access for the neurosurgeons. And then after the resection of the tumor, I actually also help with reconstructing the skull base, reconstructing that barrier between the sinus cavity and the intracranial cavity. Now, you probably heard about the cerebrospinal fluid, the fluid that surrounds your brain and your spinal cord. And if you have a tumor that is actually involving that space where the fluid is kept, or it's really sticky to the lining where that fluid is, then you can get a leak of that fluid into your nose after taking the tumor out. In and of itself, that is not a big deal. Your brain makes more of that fluid every single day. But what we don't want is a persistent connection between the brain cavity and the sinus cavity, because all of us have hundreds of bacteria, and we don't want to allow those bacteria to get back up into the brain to cause things like meningitis or other issues like that. So if the neurosurgeon is able to take out the whole tumor and they don't get any sort of leak of that fluid, then I actually don't have to do too much of anything at the end of the case. I'll put a little absorbable packing material in that very last back sinus, and the lining actually seals over very well on its own. However, if you do have that leak, then the lining won't be able to seal over on its own. It'll be kept open by that fluid that continues to leak out. So if we see that leak during the surgery, I'll actually be able to use some tissue from your own nose. I can lift up the lining of the nasal cavity off of the bone and cartilage, keep it attached to its really good, healthy blood supply, and just rotate that back as a patch. And that actually creates a really healthy, vascularized, watertight seal, which is what you need for healing in that particular situation. Now, sometimes, as the neurosurgical office likely told you, we take some tissue from your belly or from your leg if we feel like we need an additional layer or we need to fill a space in a particular way. And so those will also be options for reconstruction of the skull base. But really the workhorse of creating that watertight seal will be a flap of tissue from inside your nose. So at the end of the procedure, regardless of whether you had that flap of tissue or not, I will, at the very front of the nasal cavity, place two very thin pieces of plastic, silicone. And the reason I place those inside at the very front of the nose is that from all this in and out of instruments during surgery, you can have abrasions on both the side wall and the middle wall of the nose, and we don't want those to scar together, to scar your nose shut. So just leaving this very thin, it's 0.5 millimeters of plastic in between those surfaces allows you to heal very well without that scarring, nice and open the way that you want us, the way you want to heal. You're going to have all of this in your nose for about 2 weeks after surgery. So definitely after surgery, you're going to feel pretty stuffy, pretty congested. Your nose will continue to make the normal amount of mucus and even a little more from the surgical inflammation. So you'll feel kind of drippy, mucusy, like you have a cold. As long as you know to expect that feeling, most people tolerate it very well. The only time it can become very uncomfortable is if it gets too dry inside the nose. When that mucus becomes crusted, then that can be sort of very uncomfortable and even painful inside the nose. So what I have you start doing right away the day after surgery is spraying a little salt water inside your nasal cavity just every few hours during the day. The nurses will give that to you in the hospital, and you just keep spritzing it in there about every few hours during the day, and that will keep it nice and humidified and keep you as comfortable as possible. Okay? So the only other thing to sort of know about or expect about the hospital stay, which is typically 1 to 2 days after surgery, sometimes a little longer if we're monitoring you for that cerebrospinal fluid leak, or we're monitoring you to make sure that your hormones, your pituitary hormones, are stabilized before letting you go home. Something that we'll be asking you, my whole team of residents and fellows and the whole team of the neurosurgical residents and fellows and the nurses on the floor, they'll all be asking you very similar questions. Some of those questions will relate to making sure that you don't have that leak of fluid anymore out of your nose after surgery. They'll ask things like, do you have a salty taste? Does it taste metallic? Do you feel like something's dripping down the back of your throat or out your nose? I will say those are all quite non-specific. And remember, I'm going to have you using saltwater spray. So yes, of course, you'll have a salty taste when you use that spray, and blood in and of itself can taste metallic. So I wouldn't pay too much attention to those types of symptoms, but what I would pay attention to is if you're moving your head on your pillow, or you sit up or lean forward a bit, and you have a big leak, like you've turned on a faucet of clear, watery fluid, and it keeps dripping, it doesn't stop, it just keeps going, that is something to let us know about. That is much more likely to be a leak of that type of fluid than just the normal amount of mucus that we expect to be in your nose. So I think that's all to know about your hospital stay. Eventually, the neurosurgical team will discharge you home, and you'll get to go home, and you just keep using that saltwater spray every few hours for the whole first 2 weeks. And remember that when you come back to see me 2 weeks after surgery in my office, that visit will make you feel a lot better. That's when I'll remove the little floppy plastic pieces from your nose, and I'll suction and remove any mucus that's been collecting in your nose, because we won't let you blow your nose. We won't let you pick your nose. And if you have to sneeze right after surgery in that first couple weeks, you just hold your nose shut and say, ah, ah, let all the pressure out through your mouth. That will prevent too much pressure or movement build up inside the nasal cavity. So because of all that, you're going to feel, very stuffy and congested. But after that first visit, when I clear all that stuff out for you, you'll feel a lot better, and your breathing will feel a lot more easy again through the nasal cavity. At that first visit, I won't go all the way back to the skull base. I'll leave that area alone. It won't be ready for me to manipulate. But what I will do is at that first visit, I'll switch you from just a saltwater spray to a saltwater rinse, like a higher volume of saltwater that you're going to irrigate through the nasal cavity and sinus cavity. For some people who don't have any sort of leak or risk of leak after surgery, we may let you start rinsing your nose right after you leave the hospital. But for other people, we'll have you just using the spray, and then you'll start the rinse at that 2-week point. For those of you not familiar with rinsing your nose, if you've never used it before for any sinus issue or allergies, I will teach you how to use that rinse. So after that first visit, you're going to rinse for 2 times a day, every day for the whole next month. And then you'll come back one more time to see me in the office. So that will take us to 6 weeks after surgery. And typically by that time, as long as you've been doing everything that I've asked you as far as rinsing goes, most people will be completely healed up at that point. Sometimes if you've had that flap raised, you can have a little bit of crusting for longer than that 6 weeks as it continues to resurface and heal inside. So some people will feel a little bit more crusting on one side versus another, but we can do things to help with that also, start ointments and things like that. So don't worry, it's all part of the healing process and will eventually get you to a nice normal baseline again. I think that that is all that I wanted to let you know about this procedure. And I hope you have a really good experience with us. And if you have any questions after listening to this, please feel free to call my office or message my office, and I or my team would be happy to answer any questions. I will see you at surgery.